everyone to this virtual call with Healthwatch Enfield and Public Health. So thank you, team. I will do some really basic introductions at the beginning, and then we'll get into the session. So my name is Fazila Ahmed. I'm the Acting Chief Exec for Healthwatch Enfield. And before we start, I'll just give you some kind of what we call housekeeping, virtual housekeeping rules. So as you can see, all of you are off camera, and unfortunately, if you can all remain on mute, it just means that one, it's easier for people to hear the presenters. It allows better connection as well. It just makes a better viewing and listening experience for everyone. Equally, in terms of view, if you go, I think for most of you, if you go to your right-hand screen, right-hand corner, you'll see like a grid, and you can see gallery view or speaker view. And if you press speaker view, it means that whoever's talking will come up and be more prominent. If you note, we've also got our BSL interpreter, Pri. Thank you, Pri. So if any of you need this facility, again, what you can do to make sure that you can see her clearly at all times is if you go onto her picture, you'll see there's 3 little dots. If you click onto that box with the little dots, you'll see something called pin video. So if you click pin video, then actually that will be your main screen. So you will see pre-signing throughout. In terms of format, we have asked you for pre-questions as you were applying to join, and that just makes it easier for everyone, for us to manage the call. With so many people on the call, it would be very difficult. So what we'll be doing is still encouraging you to use what we call a chat facility. So again, just to help you, if you've not used Zoom before, if you go to the bottom of your screen, you will see different icons, and you should see something that says chat, and it's like a speech bubble. And if you actually click on that chat, you should already see that Claire, one of our team, has welcomed everyone, and they're already reminding you to fill in a survey. So I'll mention that again at the end. But again, we keep trying to improve and listen to your feedback. And so, for example, last session they said it was quite short, so we've tried to lengthen this session. So again, it would be interesting to see whether it's too long, whether the timing works well. So that's the chat button, so you can feel free to type in and make comments. What I will try to do is to help it become a little bit more interactive, is either read out some of those comments, or if we've got time, read some of the questions if you've asked them as we're going along. But I have to say that we will prioritise the questions that have already come through and been submitted, so it's more around timing, and we'll just have to judge that and play that by ear. In terms of any technical issues, it's going to be really hard to control these. So we will do the best we can. That we've covered our bases, that we have a number of us that are co-hosting, so none of us should go down. However, if you're listening as part of the audience, if you are struggling to hear or see, then unfortunately the only thing I can suggest is you log out and you log back in again. That tends to work, so do try that. And I say we've already got the survey. So without further ado, I'm going to say welcome to everyone, and thank you so much for joining us. We know how busy people are, so appreciate your time. Equally appreciate public health team. I think we've got half of the team here, so thank you for really joining us. And it's such an important topic, keeping people safe, making sure we have the right information. There's so much I would call misinformation going around at the moment, and speculation, that I think it's a really good opportunity to kind of make sure that people have the right information at the right time. So without further ado, I will ask you to introduce yourselves, but we've got Dudu, Mark, Andrew and Glenn. So Dudu.
Hi, my name is Dudu Shah Arami. I'm a consultant in public health, and I work in the public health team in the Enfield Council. Welcome. Andrew?
Hello everyone, my name's Andrew Jaja. I'm one of the public health registrars. I also work in the public health team at Enfield Council.
Welcome, thanks. Mark?
Hello everybody, my name is Mark Tickner. I'm a senior public health strategist at London Borough of Enfield, and my day job is normally helping to manage the Health and Wellbeing Board and some mental health work, and clearly in the last 3 months we're doing all sorts of other different things.
Welcome, and I'm glad you've been getting louder as you've been talking, because that's better, because we couldn't hear you very well initially, so thank you for doing that.
Okay.
And certainly last but not least, Glenn Stewart.
I think very least, I was honest. I'm Glenn Stewart, the Assistant Director of Public Health for Enfield.
So welcome. So we've got a great team, and we've already introduced Pri, who's our interpreter. So we're going to follow a similar agenda to the one we normally do, as some of you who may have joined us before. We'll have a quick update from myself. We will then have a short presentation from Public Health, just giving us some of the key messages. I know Glenn also then wants to say some words around networking and making sure messages get out across the community. And then what we do is really the bulk of the time will be spent on the questions that you guys have asked and want to know about. So quick update from Healthwatch Enfield. So as you know, we continue to be manically busy, but what we are also doing is, as things have quieted down a little bit in terms of the virus itself, we've been working on developing a lot of our reports. So we've been spending lots of time and effort really trying to engage with all of you residents, patients, service users living in Enfield, to get your perspective in terms of what's been happening with the virus, how has it been affecting your health, your experience of services, whether it's health or social care. So we've got a couple of reports almost ready to publish. One, a very generic one around the impact of COVID on yourselves, and some positives, as well as obviously the challenges. And we've been focusing as well some of our time and effort around young people, because their voices are not always heard, and particularly with issues around, you know, lack of school, lack of certainty around exams, etc. We hope to publish a report on that shortly. But two reports that are already out. We had our annual conference literally just before lockdown in March, and we have now published the findings from over, I think about 150 people attended that, a whole mix of backgrounds, which was really great. And some key messages around there were really valid for now, in terms of people needing clear and accessible information, things that they can understand. They want to be involved and engaged with any of the changes in services, as we're kind of looking at services again in this kind of new world, making sure that everything is equal and inclusive, so that we're not kind of, I was going to use the word marginalizing, we're not excluding already those vulnerable groups who found it challenging prior. And looking at what works and what doesn't work. So looking at things like digital technology solutions that do work for a lot of people, but equally, again, we don't want it to be that if that's the only way to communicate, how do we ensure that people can access? So for example, we've got Pri with the BSO interpreter, we're recording it, and we're hoping that we can try and get messages out in various ways to all members of the public. And finally, we have our annual report as well. If you want to see what we've been doing last year, and there's lots of good stuff in there. Everything's on our website. So yeah, do have a browse, and when you're bored and you've got a spare 5 minutes, have a look. So I'm going to pass you on now to Dudu to take us through your slide set. Thank you.
Thank you, Fazila. I'm just going to share my screen with people so that they can see the slides as well.
And that takes just a minute or two, so bear with us while we're doing that. Okay, we can see you, Dudu, so.
Great. Okay, so this is just to introduce the team, which we've just done. So let's press on into the presentation. So this is what we're going to, I'm going to give you a very brief run through, just a little bit about the background and what coronavirus is. I'm going to go through a little bit of information about the pandemic so far and give you an insight into some of the local data that we have. Then a little bit of the guidance around the infection control advice that we would really want everybody to be using. And then we'll get into the session around the commonly asked questions. So I think just to start us off with, this is very much a new situation. And whilst for many years we have been planning for some kind of pandemic or, pandemic flu, there is lots of learning that we've all been going through over the last few months. And there is still lots of things that we don't know yet and are sort of finding out on a daily basis new things about the virus. And so just to say that, if there are any questions that come through that we're not able to answer, then we'll do our best to go away, find out some information for you and get back to you about. But I think it's certainly worth bearing in mind that this is a new situation for all of us, and we're all learning through, how to best manage. So I'm sure a lot of this is going to be very familiar stuff from you, for you. So in terms of the symptoms of coronavirus, the things that we're looking for most commonly are a high temperature, a new continuous cough, and loss of or change to the sense of smell and taste. You'll have also heard that there are lots of other symptoms that people have experienced, and in fact one of the things that we have learned about this virus is that some people have actually been experiencing more longer term issues. But those three symptoms are those that are most commonly experienced. The transmission is via droplets, and we are learning more about how the virus is transmitted, but essentially it's droplets that are expelled into the environment, into the air around somebody who has become infected and is infectious. And those droplets can land on surfaces and contaminate surfaces, or in fact can be breathed in by people who are standing near to them or are with the infected person over a period of time. The incubation period is between 5 and 14 days on average, and that's the period of time between when somebody is in contact with somebody who is infectious to the time that they might develop symptoms. In terms of the severity of the condition, I'm sure that you're all very aware that there's a huge variation in how people experience infection with coronavirus. And there's a significant proportion of people who don't experience any symptoms at all. And then also a significant proportion who experience it as a very mild disease. And the majority of people will not require sort of contact with health services in relation to their symptoms. But we do know that there is a greater chance of experience complications of coronavirus if you have any long-term conditions, particularly if you've got any respiratory conditions or circulatory or heart conditions, and also if you are an older person. So that is something also to consider. So as you can imagine, we in the public health team are receiving a huge amount of data in relation to numbers of cases, test, track and trace, and all sorts of information that we are examining on a daily basis and keeping a very close watch of. But I think the main trends that I wanted to highlight to you today are that since the end of April, we've seen a consistent downward trend in the number of cases. And I think that's obviously really good news. Also, in terms of the number of deaths that we've seen in Enfield, we have also seen a continuous decrease since the peak at the end of April. And that's across all settings, including care homes in Enfield. And in fact, we've reached the stage now when the average sort of mortality is now below what we would expect it to be for this time of year in Enfield, which again is very good news. How we look at the numbers of cases is we kind of build an average over the last week, and so our 7-day rolling average as of yesterday was 2.29 cases identified in amongst Enfield residents. So again, there may well be more people who are unidentified, but those people who have received tests, you can see, and been identified as positive cases, you can see it's a very small figure. Again, good news. You'll have heard a lot of information and discussion about how the issue around inequality has really been sort of highlighted by the pandemic. And certainly we know that in terms of complications of coronavirus, older people are disproportionately affected. Men as well have a higher proportion of complications. Those who have long-term conditions, some minority ethnic groups and some occupational groups have also been disproportionately affected. And we're learning more about why that is and what the mechanisms are as we go by. You'll have been aware that since the beginning of the pandemic, the government advised a range of people who were either due to age or due to certain health conditions were advised to shield themselves by maintaining really stringent social distancing. And amongst Enfield residents, that's been just under 3% of the total population of residents, which has equated to just over 9,000 people. And just to add, you may well be already aware that the shielding advice given by the government will be paused as of the 1st of August. The rationale behind that is because in general, across the country, the circulation of the virus has come down significantly in comparison to the peak time back at the end of April. So I think that this next slide is really important for everybody. We've all got a role in infection control and in sort of sharing the accurate messages with our family, friends, and those people who we come into contact with. So the key thing is to minimize contact with individuals who aren't well. And we all have a responsibility around that. So if you yourself find that you have symptoms of coronavirus, then you need to self-isolate for 7 days and also to seek testing. Those that you live with in your household need to self-isolate for 14 days. And that's to take into consideration that incubation period that we spoke of earlier. So that's a really, that's a very strong piece of advice, and that's a responsibility that we all have. And then thinking about ways in which we can further protect ourselves and those around us, to conduct frequent hand washing, good respiratory hygiene. So the old message about catch it, bin it, kill it if we do cough or sneeze, you know, to try and contain, you know, onward infection. You'll be very aware that there are now settings where we're all required to wear a face covering. So currently that's on public transport and in retail settings, such as shops. And then also to, you know, we all have a responsibility if we do become symptomatic and if we are contacted by NHS Test, Track and Trace, is to follow their advice. I think those 5 points are really the key things that we can all take forward to try and limit the spread of infection amongst our communities. I'm sure you'll all be really sort of keen to hear what we're doing sort of across the local authority and the NHS and further afield to manage the situation here in Enfield. So we have developed a local outbreak control plan that is a public document, and I'm sure we can share the link to that so that those of you who are interested can have a look. We're going to be working on that as we learn more about how to control and manage outbreaks at a local level. We're also working across London and also with other areas of the country to try and learn as best we can from other experiences. We're also working with partners, including the NHS and the local voluntary sector, to support recovery and address the issues of inequality that the pandemic has really highlighted. And I think it's important to say around that those are inequalities that were pre-existing within our communities prior to the pandemic, but actually the pandemic has presented almost a kind of opportunity to harness extra motivation to address the issues of inequality. We're also going to be doing a lot of work around winter planning this year, and that includes a kind of extra emphasis on our flu planning and our flu campaign. And I would really stress to all of you to ensure that you do get your flu immunisation this year. And of course, we're going to be engaging with the future sort of national programmes and implementing the national guidance that will develop as we learn more and go through the pandemic. And so that's the end of the presentation. I'm going to stop sharing my screen now and hand over to Glenn.
Actually, just before we do, I've just noticed a couple of comments coming through on the chat. So is it okay just to flag a couple of them?
Yes,
so
of course.
You may or may not know the answer off the top of your head. And again, if you don't, you can go look at the information and then perhaps we can publish it with the Q&A.
Yeah.
But somebody was asking around care homes and looking at the proportion of deaths that were in care homes. Oh, is Mark waving? Is that for you, Mark?
Yes, this came up in the Health and Wellbeing Board last week. In terms of absolute numbers, I can forward them to you later on. In England as a whole, I think the proportion of deaths in care homes is between sort of 38 and 42%. In Enfield, it was actually 50%. The reason for that is we have a significant number of care homes. The other north central London borough that has a similar proportion of care homes, of course, is Barnet, and they have very similar figures. In terms of other countries, Scotland had 50% of their deaths in care homes as well. So it's not just a London or North Central London thing.
Okay, so I guess it's what you're saying is it seems to be proportionate to the number of care homes that exist in a given area.
Yes, elsewhere in North Central London, the boroughs which are closer into London, their proportion of deaths in girls is much less because they hardly have any, and their prevalence rates were lower than us as well, I think, because of that reason.
Okay. Somebody was clarifying also the testing result of the 2.29%. I'm assuming that's of those who actually went for a test and therefore tested positive. So I guess it's an indication as opposed to an absolute. I don't know who wants to.
Yeah, that's absolutely right. You know, we obviously there may well be individuals who you know, are asymptomatic, meaning that they don't have any symptoms. They're not aware that they have an infection on board, and therefore they don't seek testing. So yes, that's correct. That figure is in relation to individuals who have tested positive.
Yeah, so already they have a sense that they might have something and therefore are checking it out. Okay.
Yes.
All right, thank you. Then just the final one, and then we will absolutely move on to Glenn, was a comment about, you know, keeping the public safe through litter. So there's over litting. It says, is health taking a joined up approach over litter and overflowing bins that keeps seeing discarded masks and gloves on the ground? Don't know who wants to take that one.
Yeah, so I mean, obviously we've all seen that happening, and we would very much encourage people to wear face coverings that can be washed and reused rather than the disposable ones. In terms of the use of gloves, that is not something that we are encouraging unless people are actually in sort of settings which Public Health England are advising the use of gloves, such as clinical settings. It's certainly not something that we would advocate for, you know, by members of the public. And, you know, we're very much aware of the environmental impact that that has.
Yeah, absolutely. You just have a plastic mound. I mean, I don't know, and this is just an observation, so please, this is not professional advice, and public health, do jump on me if I'm saying the wrong thing, but even if you're wearing the gloves, you need to take them off really carefully, but you can just leave them in a corner to decontaminate for a few days and then, you know, reuse them or wash them.
Yes.
So, you know, rather than just binning them or, you know.
Yeah, absolutely. And, you know, we would certainly, the reason that we're not advocating the use of gloves, and Public Health England is not advocating the use of gloves by the public, is because they can become contaminated, and it makes no difference whether you sort of are wearing a contaminated glove and then touch your face or put your finger in your mouth or your eye, you know, and become infected that way, or whether you're actually doing that with your hand. And you know, people who are not wearing gloves might well be more inclined to wash or sanitize their hands more frequently. You know, those who are wearing gloves might feel some level of protection, you know, incorrectly because of their glove wearing.
No, I understand that, and I guess I think the point that they're also making is the fact that the litter and the bins overflowing. So I guess it's just a point to note, I guess, for the council and health, thinking about how that's managed.
Yes, and we can certainly have a conversation around that with our waste disposal colleagues.
That would be helpful. Okay, I am now going to move us on to Glenn. I know you wanted a few words.
Yeah, thank you, Priscilla. Really, what we're looking for is that many people now are saying that we're between waves. So we've had the first wave of COVID, and as Dudu was saying, the average number of deaths now is what we'd expect to be, or lower than what we'd expect it to be normally. There's many people planning for a second wave, which isn't to say there's definitely going to be a second wave, but if there is, it could be quite severe, particularly if it lines up with winter flu and you have two viruses circulating at the same time. So obviously now we've got a little bit of time to prepare and plan for a second wave. And what we'd like to do, or what we'd like, is support through people like yourselves and Healthwatch and the voluntary sector for disseminating messages and enforcing messages around COVID going forward. So there's only really one or two things you can do about COVID: either not get it, you know, ideally, or have it treated elsewhere. So in terms of public health and not getting it, it's quite a sort of, you know, almost a simple message in a way, and it's around the things we've been sort of hearing all the time. So about hand washing, can people, you know, there's a study showing that if people hand washed, it would reduce infections by something like 13 million over 150 days. Social distancing, you know, that's, you know, everyone's sort of seen that, but we need to enforce it and make sure that people understand what it actually means, and that social distancing, it means all the time. So we had a scenario given to us whereby people were maintaining social bubbles during the day, but then getting in each other's car at the end of the day. So when we're talking about social distancing, it has to be all the time. Like you can't sort of, so the virus doesn't finish work at 5 o'clock and think, okay, we're all fine now. It has to be all the time. Then there's the, you know, we'd like to reinforce the test, track and trace system so that if someone does test positive, that all their contacts are followed up. And what we're constantly looking to do is to reduce the spread of the virus, like just keep it contained, and naturally then it will sort of die off. And as Dudu was just saying, absolutely, like, to get your flu jab this year, and encourage everyone to get their flu jab, because, you know, the worst case scenario would be the two viruses circulating, interfering with each other, mucking up treatment for each other, and the sort of the double whammy effect. So going forward, what we'd like to do is gain support from yourselves, and if you can come back to us and say how we can help you, but to disseminate those messages across the community, and particularly in BME communities where we saw the effects of the virus are much worse than the rest of the population. Priscilla, you're on mute. I've gone deaf.
Sorry, yeah, I'm chatting away going, oh, I'm on mute. So no, I think really important messages is that we can all pass these messages on and try and be clear, and we'll all be, you know, working with communities, friends, family, or we might have, you know, we might be community leads, etc. So I think it's really important. I think it's important for two-way feedback as well. So equally, while we're passing on these messages, if we're hearing information or experiences, then do feed that back up to either directly to public health, or of course to Healthwatch Enfield. That's what we're here for, so that we can help that two-way communication, because I think that's absolutely critical at this point. Okay, I think we're going to move us on. Just again, please keep using the chat, even if we don't pick up every point on there. Note it's recorded, and that we will follow up if anything is missed. So hopefully those points will be noted that you're mentioning at the side there. So these are the questions that we shall start with. So this one is 3 questions. One person's given 3, so I'll read all 3 out, and then you can take them one at a time. What support is being given to those who have been shielding and suddenly it's ending or pausing on the 1st of August? What are the current risks of a second wave of coronavirus? 2 exclamation marks, I think we're all waiting. And then what support or emotional support is being offered to those working within the healthcare system? Dudu.
Great, thank you, Fazila. Okay, so I'll start with the first question. At the start of the pandemic, the local authority, and also working very closely with you know, Fazila and a lot of other community voluntary sector organisations have sort of developed a support mechanism for those people who were shielding, and that included food, delivery of medicine, regular phone calls, particularly amongst those who identified that they were socially isolated. The government, as I mentioned before, is going to be pausing the shielding advice as of the 1st of August, and that's due to the reduction in circulation of the virus. In terms of our support for that cohort, that group of people who have been shielding, all of the individuals who have received support are being contacted to ask sort of what level of support they need going forward, and are being signposted into local services and local voluntary sector groups to receive ongoing support for those people who need it. And of course, you know, many people will not feel that they need ongoing support as well. The provision of food parcels will continue until the end of July. And for those people who need that on an ongoing level due to their sort of financial or social care situation, we'll be making referrals into Enfield Food Bank. We've also issued face coverings for all of the individuals on the shielding list. And for those people who've identified that they have financial concerns, then they are being signposted into our council financial assessment service to really explore what those issues are and how we can best support them. And those people who requested regular contact because they were socially isolated, that service is going to continue as a commissioned service. So I hope that gives you a flavour of the sort of work that is ongoing to support that group of individuals. And of course, what we are doing as well, you know, we are aware, of course, that there is a possibility, a distinct possibility of a second wave, and that shielding advice might be reinstated, so that we will need to have this service available to be sort of utilised in that circumstance. So the second question is, what are the risks of a second wave? And, you know, I think, as Glenn has said, you know, none of us have a crystal ball, but we can see, and sort of particularly if we look at what's happening in other countries, as people sort of reintegrate together more and more, it provides opportunity for recirculation of coronavirus. The virus isn't going to go away, and so it is a distinct possibility that we will have a second wave, and we are all working hard to plan for that. The third part of the question around the emotional support being offered to the healthcare system. And if I will add in there as well, in terms of social care, who are important as well. So we know that currently the leaders of the North Middlesex Hospital are working around to develop a wellbeing offer for their staff. And that's not only around emotional well-being, but also sort of their physical well-being as well. I think it's fair to say that clinical staff often have an extremely good sort of system in place for debriefing and sort of supporting staff around emotional well-being as well. In terms of local authority staff, we have a staff counselling service, and all of our team leaders and managers have or are in the process of receiving training around mental well-being, so that we're able better to support staff. We've also opened up the availability of the council counselling service to staff working in care homes across the borough. So that's another sort of way in which we're trying to support care home staff. And in terms of school staff, again, another sort of important group in of key workers, the council's educational psychology team have been working very closely with schools to ensure that each school has a kind of process in place for supporting their own staff. So that's
okay. I'll just ask one. There's a few questions here, but just one of them. It says, For the shielders, who's contacting this group of people and how are they going to refer?
Yeah.
Sorry, can you just repeat that question, please, Fazila?
Sorry. Who is contacting the group of shielders and how are they going to refer?
Okay, so at the start of the pandemic, the council were provided with a list of people through our work in collaboration with the NHS of individuals who are on the shielding list. So we've been in regular contact with them throughout the pandemic, and so many of our staff were sort of diverted into supporting those individuals from their, day-to-day jobs. And so it will be council employees who will be contacting the individuals and who will be referring, depending on what the various individuals' circumstances are, will be referring into appropriate support.
Okay, thanks. And somebody's raised, which I think is really key, about mental health. I mean, you've touched on that, but somebody's saying they're living with someone who was bereaved and struggling with anxiety even before COVID.
Yeah.
Actually, now that's just increasing their anxiety and they're scared to go out at all. So there is a real challenge there, I think, for everybody's mental health, actually, whether you're staff working or you've, suffered bereavement, or indeed, I think somebody's mentioned on the chat, you might have had COVID, but you're recovering, but you haven't suddenly bounced back.
Yes.
And we're hearing of people recovering not that well, and it's taking quite a lot of time. So I guess it's just flagging there, thinking about the support between whether it's public health, local authority, social care and health, to look at almost a new form of ill health.
Yes, absolutely. And, likewise, we're very much aware that for some people, recovery is not, is a long-term thing. And so, people will need to have assessments both from a kind of clinical perspective, but also possibly from a social care perspective as well.
Yeah, and I would just add for anyone that, in the general public who would like to look more into kind of like services or advice around mental health, the NHS Every Mind Matters website is a very, very good one, and plugs, there's lots of information, really credible sources, links to lots of different types of helplines, including bereavement services. So that might be a good place to start looking as well.
Okay, thanks Andrew. Okay, I'm going to move us on now to the next set of questions. So Mark, I think this is for you. We've got Enfield's, is it test, track and trace, or test and trace? I've seen different wording now. It is test, track and trace. Okay. How long has it been up and running, I guess, in Enfield, and how is it working? How effective is the tracing? And is it making any difference to Enfield's new COVID infection rates?
I'll start with this, and I think Ben might want to say a couple of words at the end. Basically, it's been running now for a month. This is, to a very large extent, early days. The rates of detections in Enfield are still running on average about 2.25 a day. That level has inflated slightly over the last 2 or 3 weeks. That inflation in figures seems to be associated with the partial relaxation of certain rules, particularly around people going to pubs and restaurants, that sort of thing. There were some issues around communications information coming into Enfield from both Public Health England and health protection teams initially. Certainly you saw that manifest itself in Leicester. Things have changed a bit, so the Blackburn situation, which you might be aware of, is being much better managed. It is early days. Public health nationally and regionally have always had measures and teams that investigate this sort of thing, but we haven't done it on this scale before. One of the things that you will see in the next few weeks is that we just started off regular testing in care homes in Enfield. This will be initially care homes for older people, but you will see detections, so numbers will go up. That does not necessarily mean that we're heading for another significant second wave locally, or we've changed the way we're doing things locally. So at the moment, it's early days. Things will change. I don't know, Glenn will say something.
Not a lot, really. I think, you know, we have to be very careful about the numbers coming through from testing, because the more we test, the more we'll get results, which is a good thing because we're picking up the infection and we can contain it. We don't want it to spread before it's, you know, so far that it was out of control. But you do need to take the testing numbers and the number of people testing positive with a little bit of a pinch of salt.
Sorry, I'm just conscious I'm on mute again. Doesn't help. Okay, let's move on then. So please, next question, please, can we have pneumonia vaccinations and flu vaccinations for at-risk groups as a matter of course?
Yes, and I'm going to take that question. Nationally, adults who are over the age of 65 are eligible for a pneumococcal vaccination, and that's the pneumonia vaccine. And that's a vaccine that is provided once. You don't need to have it every year. So as long as you've had it, then you don't need to get it again. In terms of flu vaccination, this year's flu vaccination programme, as we've already mentioned, is incredibly important. There are a number of groups who are ordinarily eligible for flu vaccination, and those are primary school children, I think also year 7, which are the first year of high school, those who are over the age of 65, and also a range of people who have various underlying health conditions. And so all of those people will be eligible for flu vaccine. And we are putting together a very comprehensive plan so that amongst Enfield residents, we can maximise the uptake of flu vaccine amongst all of those groups, and also our key worker groups as well. And that's that's important every year, but this year it's even more important. So again, it's a message to everybody to make sure that they do get their flu vaccination this year.
And in terms of capacity then, because I think last year, weren't there problems with getting the flu vaccine? So even when people wanted them, it was a struggle. So are we planning to get more in this time?
So last year, there was a problem with the flu vaccine internationally, and it resulted in a delay in pharmacists and primary care settings receiving the vaccine. We're in very close contact with NHS England, who are the part of the NHS who oversee vaccine programmes, and they are not anticipating a delay this year, which of course is incredibly good news. So we're anticipating that from September, settings will be receiving their allocation of flu vaccine. So whilst last year the issue was essentially out of our hands because it was a production and sort of supply issue, we're not anticipating it this year, and so we'll hopefully be able to commence our programme as soon as the vaccine comes into the settings.
Okay, thanks. Just to note that keep an eye on the chat, because Glenn's added in flu vaccine jab and how to get it, and obviously our guys have been updating on links, etc. So keep an eye on that. And somebody's also commented that 2-3-year-olds, I know young children are eligible for the nasal spray.
Yeah,
okay,
great. Thank you for those additions.
Yes, all helpful.
It would be useful as well just to mention that we in terms of a COVID vaccine, then we just don't know as yet. First of all, whether that's going to be available. We are having some good news about that. That people might be aware of, but until that's actually sort of fully developed, then we don't know exactly what that's going to look like, or when, if at all, that's going to happen.
Okay, and somebody's just mentioned, which I think is valid, around the flu vaccine. Given what we know now about the BME populations or some of the groups, is there any plan to look at supporting them, prioritising whether it's the flu vaccine or any other?
So what we are doing is working very closely with NHS England to make sure that amongst our risk groups, flu vaccination coverage is as high as possible. We don't commission vaccine programmes from the local authority. That is commissioned by NHS England, so we don't have control over that. But you know, there is a really important kind of message to make sure that the information that we get through to local communities is culturally competent, and that people who are eligible for flu vaccine, you know that and know how to get it. So I think that is a really good point, and of course, you know, we're in regular communication with NHS England.
Okay, so at least you're looking at that.
Yeah.
Okay, I'm going to move us on. I'm just conscious of time. There was a couple of other questions as part of that. Was can a specific blood test, which I'm not even familiar with, HbA1c, blood test be resumed urgently, and can diabetics be prioritised for the COVID vaccine?
So HbA1c is a blood test that's used to establish whether an individual's diabetes is being well managed. That really is a primary care issue, and each individual should be sort of in contact with their clinician, their GP, to kind of look at the management of their own diabetes. So I can't really comment on that. In terms of sort of diabetics being prioritised for COVID vaccine, again, nobody knows at this stage what the national programme of a COVID vaccine would look like. However, it does absolutely seem sensible to me that you know, diabetics and others with long-term conditions would be prioritised. But again, you know, we just don't know what that looks like at the moment.
Okay. All right, I'm going to move us on again. Next set of questions, actually, I think for Mark or Dudu. What's being put in place to support the wider public health issues that will intensify as a result of the pandemic? So whether that's homelessness, poor housing, poverty, as well as digital exclusion.
Yeah. Thanks, Fazila. So Andrew and I are going to do a double act on answering this question. So I'll start off. And as a local authority, we're working extremely closely with our colleagues across the CCG, the NHS, and also the third sector, to look at how we are addressing inequality locally. And you know, the person who wrote this question is absolutely right, that COVID has really highlighted significant levels of inequality that were pre-existing to the pandemic. And you know, we're very much looking to use this as an opportunity to maximise sort of people's and organisations' motivation to address these issues. And so we're working with those organisations both at a strategic level, but also at an operational level to develop plans. They are embryonic at the moment, so I'm not in a position to kind of give you the detail because it's not yet been agreed. But we've got lots of examples, and Andrew's going to tell you a bit about what we've been doing around sort of rough sleeping and homelessness. That will kind of let you know some of the more operational details about how we're looking to address inequality.
Yeah, so regarding kind of, thanks, Dudu. Regarding homelessness and rough sleeping, you may or may not be aware that as a result of COVID, the government has asked all local authorities to bring everyone in, all rough sleepers, and house them, and those that are and those homeless that were in dormitory style housing, which was really not appropriate for kind of social distancing measures, and were, you know, higher risk as far as infection transmission. And so the local authority in Enfield has been working very, very hard. They've been working, includes housing teams, rough sleeper teams, public health, and the CCG. We've all been working very, very closely together to house rough sleepers. And not only that, but using this opportunity where you know, we're providing you know, this accommodation for rough sleepers to try and address kind of the long-standing health and well-being issues for this group of individuals, which is often complex and also exacerbated by having no fixed abode or home base, really. So to kind of give you just some brief highlights, because I'm conscious of time, of the stuff that we've been doing. We've been, you know, identifying rough sleepers who are clinically extremely vulnerable, who are shielded, and kind of reaching out to their GPs, getting them medical reviews where appropriate, and asking GPs to feed into housing plans. We've also been working with pan-London groups to kind of offer a full health questionnaire led by clinicians, so GPs, and plugging those rough sleepers into local services. So that would be around substance misuse, sexual health needs, stop smoking needs, and primary care. And actually in Enfield, one of the biggest challenges around rough sleeping is getting people registered for primary care. And in Enfield, we've been able to facilitate registration for rough sleepers so that over 90% of our rough sleepers and homeless are now registered with primary care GPs, which is, for example, some other boroughs in London are around 30%, you know, as low as 30%. So we've been doing lots of work to try and use this opportunity to help those that, you know, like we said, that COVID highlighted inequality among those. The other thing, kind of addressing poverty, is we also have the Enfield Poverty Commission, who has done some fantastic work at looking at poverties and factors of poverties and the kind of multifactorial situations in Enfield leading to poverty. And they have actually put forward kind of like a strategy and action points to the council. And we as public health plan on kind of addressing some of those points and where we can, and working towards those strategies and actions with other departments in the council as well.
Thanks. It's just useful to know, and I guess you know, I guess we can't underestimate the work that needs to continue, because I think, you know, like we said, we were all aware of it pre-existing, and it's just reinforced. So whether it's been helpful to have a renewed focus and vigor on some of these issues that have been underlying in society for years, but I guess equally, you know, these poor rough sleepers, you know, if it's helped them sign up with GPs, etc., then actually that's positive. But I guess we can't underestimate what we have in front of us, whether we talk about poverty and people coming out of furlough perhaps and losing their jobs. Yeah. Somebody else is on the call mentioned, you know, massive mental health issues when mental health services were already struggling. I guess, you know, we just have to work through a piece at a time and try and make a difference where we can. Otherwise it could feel kind of overwhelming. So yeah, it was good to hear some of that work that's being done. Yeah. Okay, I'm going to move this on just to get some more questions in, but feel free to do afterwards to pick up if we've got time.
Yeah.
So this one's about children. It says, what's the risk of children getting back to school, getting it and getting the virus, I'm assuming, and passing it on to their parents or grandparents?
You know, so we do know that this is a risk. This is one of the areas, though, that we are learning more about as we go, you know, as we go on. So at the moment, we know that children don't transmit the virus any more than adults. But in fact, there's a growing kind of level of evidence to suggest that children may actually transmit the virus less. So that's, if that is the case, that is definitely good news. As well, I'm sure that people are aware that in terms of how children experience symptoms, you know, children tend to experience a very mild form of disease, you know, if any symptoms at all, which again is of course good news. In terms of how we manage cases within a school setting or even in an early years settings, we are working extremely closely with schools and as a kind of extension of our local outbreak control plan. We've done a number of sessions with schools to make sure that they are all up to date in terms of the social distancing guidance and their plans for bringing all children back to school full-time in September, which is the government guidance at the moment. So the key sort of infection, there are key infection control measures that schools will be implementing, which are pretty much the same as the ones that I talked about in the presentation. Schools will each also be developing plans around sort of minimizing the kind of level of contact that different groups within their school have with each other. And each school will have their own individual plan. Schools have done risk assessments as well to kind of look at particular issues that each school have. And as well, we have our local outbreak control plan with a specific section on schools and early years settings. And that's really around the management of a case within a school setting. And, you know, we will be working extremely closely with schools to make sure that happens in a timely way, and that school communities receive the right level of information so that they can sort of abide by the self-isolation recommendations that the NHS track, test and trace provide in the event of a case within the schools.
So it's just thinking about that testing, is that going to be more automatic then within the schools? Will staff be tested, are children being, not necessarily routinely, but as soon as they might be ill? Is that
so the advice that we are giving, and this is following through on Public Health England advice, is that if a child or a member of staff develops symptoms, then they should pretty much immediately go and seek a test. And then depending on the result of that test, we would then activate the plan around, you know, controlling the outbreak, the kind of spread of infection within the school setting. Public Health England would work very closely with us in relation to that as well, and would be involved in any outbreak control work that we do with schools. The key thing as well to remember is that in September, when all the pupils go back to school, we'll then be also entering into flu season, and obviously people will be very aware that the symptoms of coronavirus and flu are almost identical, you know, maybe apart from the issue about sense of smell. And so the rationale for bringing all the children back to school in September is that currently the level of infection that we have within our communities is at a very low level, and that you know, we're very aware that you know, not having education in place and not having regular contact between schools and children can also be detrimental to their well-being and also to their educational achievement. And so, you know, I think it's all about balancing the risks and managing cases if and when they do occur in a very timely and sort of well-managed way.
No, I guess that makes sense. But well, yeah, I think it's also for parents' well-being.
Absolutely.
Just for parents with kids working being at home. So I guess what we're saying is no, we cannot reduce. We can't eliminate risk.
Yeah.
We can't take that away. But actually, what we're trying to do is all work to reducing the levels of risk by taking all of these various actions.
Absolutely, that's exactly. You've really hit the nail on the head with that sort of message. And we can't take the risk away. It's not going to be eliminated. But all of the infection control measures and the measures that we're putting in place for different settings are all about reducing the risk, and where a case does occur, managing that in a very timely, an effective way.
Okay, brilliant. Okay, let's move on. Next question here. We've touched on it slightly, but it's specific about the Black and African ethnic minorities. So it says, will local BME communities get additional support given they are more at risk? And if so, what kind of support is being considered?
That's my question. Public Health England published 2 reports at the height of the COVID-19 epidemic relating to apparent BAME vulnerabilities to the infection, and the second report was the one that made significant conclusions. And essentially the reasons why BAME people are more vulnerable to both acquiring the infection and more severe forms of it is twofold. And the first is that, generally speaking, people who are in people-facing roles, therefore likely to be exposed to the virus, tend to be more proportionately BAME background. But these are the people who are working in our transport systems, these people who are working in our care homes, these are the people who are working as taxi drivers, these people are working obviously in the NHS. The second issue is that why do these people seem to have the more severe forms of COVID-19 infection? That's because there are certain disorders, particularly type 2 diabetes, uncontrolled hypertension, which the virus takes advantage of. Allied to that is the fact that people who are working 80 hours a week or working jobs with irregular times can't get to primary care. They can't get the ongoing care they need. And so one of the things that Public Health England were repeatedly saying was we need to change the sort of primary care offer to become culturally competent. And that's going to be a significant transformation in the way we do things, but will take some time. Now, certainly this was discussed at the Health and Wellbeing Board last week in the context of things like the quality of accommodation, the nature of jobs, that sort of thing. That's a sort of societal change, and that will take a while. In the context of the second wave of COVID-19, there are certain things that we can start to address. And one of the things has been mentioned is the influenza vaccination. And the other thing is about if you have an underlying health disorder, then make sure at all costs, make sure it's being addressed. Try and make contact with your GP and get that addressed. Get your blood pressure taken. Get your, somebody mentioned the HbA1c test, which is a test for type 2 diabetes and blood sugar. Get that sorted out. Now, certainly the new co-managing directors of Enfield Clinical Commissioning Group, they are absolutely focused on tackling health inequalities in Enfield, as we are, but it will take a while to get there. It will take a while to make that change. But we have to make that change, because if we don't, irrespective of the second wave of COVID-19, there will be an influenza epidemic in the next few years. And the people who are vulnerable to COVID-19 are probably going to be vulnerable to something like that. There may well be, for the sake of arguments, a significant heat wave, like the French had in 2003. And again, the people are vulnerable to COVID-19, they'll be vulnerable to that. So we have this keenly in mind. But it's not something we're going to see significant changes rapidly. We're talking about societal changes here and massive changes to the way we do primary care. But it will be a core part of our joint health and wellbeing strategy moving forward. And we'll let you know what we're doing as soon as we actually start putting things into place.
And I guess, Mark, then it wouldn't just be the CCG, the Clinical Commissioning Group, but I guess it's primary care, so the GP practices,
Yep.
the GP Federation.
Yep.
I guess, are they on board in terms of these changes?
I think one of the things that's happened is obviously with primary care coverage is that they went almost remote very quickly. They went sort of virtual GPs. Now, To give you an example, I just arranged my repeat prescriptions this week, which took me several clicks of a mouse, and I did it practically instantly because it was wonderful. If you speak English, if you actually have, I mean, I can read English, and if you have really reliable digital access, and you can, and you're reasonably au fait with NHS terms and things. Now, if English wasn't my first language, and let's say I couldn't actually read English, I think I would have some difficulty navigating that. So there's a number of things need addressing. I think need addressing quite quickly. Now, I've seen some quite advanced sort of formats of primary care for a genuinely multilingual community up in Blackburn when I was working up there. So I'm not sure why we can't repeat those down here. But yes, there's lots of things we've got to do. The trouble is, at the minute, we're slightly hamstrung by all the work we're doing around this stage of the COVID-19 epidemic.
I guess it's just important that it's kept on the agenda, and maybe also sharing. So, you know, I noticed with Blackburn, they had some videos in different languages. So I guess it's thinking about, you know, taking some of that, or if we have to create our own, because there isn't anything at the moment, but it's making sure that actually messages are getting across and support's being provided. And again, back to your point about digital, that it's great for lots of people, but doesn't work for everyone. And we can't just rely on that as a way forward.
No, absolutely.
Okay, and just noting in the chat, guys, if you are interested in these reports, Emma's kindly added in the link. So, like we planned it.
Yes.
So the next question is for Andrew, I think, here. So can the council consider some kind of letter or confirmation if a resident has learning disabilities or autism or any other disability, in fact, or health problem, so that if they can't wear a mask, for example, and maybe they can show if challenged?
Yeah, the current guidance does, you know, note and is very much aware, you know, the PHE guidance, that there are certain people who have might have medical conditions or other, you know, health and well-being, you know, considerations that might not allow them to wear a mask, and those people should be exempt from wearing a mask. It's also the same for, you know, very young children. For example, children under the age of 11 you don't have to wear a mask either. And I guess one kind of reassuring thing is that if everyone else wearing a mask is, as Mark always says, is about protecting the others around you, not necessarily about protecting yourself. And if we think about masks kind of like in the way that we think about vaccines, if everyone who can get, you know, who is able to wear a mask does so, then it helps protect the people that cannot wear masks. As far as how that is being challenged in settings or public transport, I'm not personally aware. I don't know if Mark or Dudu is aware of how, you know, how that's being challenged, as far as if people are asking for written confirmation or you know, a letter from their GP or things. I'm not aware, to be honest with you. But I think it's something we can certainly explore. It's not something that we're doing now in the council, but it's something that we can certainly explore. I don't know if Mark or Dudu had anything else they wanted to add to that.
In terms of shopping, I understand the Metropolitan Police has said they're not going to be policing this in terms of mask compliance, also face covering compliance in shops. And I understand on Transport for London, they have started tightening the screws in the last couple of weeks. I think you're right. You need to go away and investigate how they investigate exemptions.
Yeah.
Because I'm not sure.
So
I'm actually not sure.
We can find out a bit more about how you know, how this is working on public transport, and we can get back to you, Fazila.
Yeah, I think this question clearly is suggesting that perhaps people may be thinking that they will get challenged. I can imagine there's people with hidden disabilities. It's not obvious suddenly that they have, and they may be over 11, and you know. So I think there's something around how do we stop the the already difficult situation becoming more difficult, because people are saying, it could be members of the public, not even, you know, can suddenly think, oh, being very judgmental. So it's just something that might be quick and easy. I know Sainsbury's, they have the, you know, support passes that you can wear. So I just think it might be worth thinking about for Enfield. Okay, so we're going to move on. So I think this question actually is for you, Dudu. Now that local authorities will have the power to impose a local lockdown, what criteria are you going to use to make that
and this
decision?
It's a really excellent question, and I think it links back to the work that we're doing with other boroughs, and also learning from those areas of the country that have already experienced a local lockdown. So we are working with our neighbours to look at what the new powers mean for local authorities. When I say our neighbours, I mean our neighbouring boroughs, because obviously, you know, pretty much anything that is happening in Enfield in terms of transmission amongst residents is likely to be reflected in our neighbouring boroughs as well, because, you know, none of us you know, stick to our borough boundaries, you know, when we're, you know, maybe going to work or you know, visiting people and you know, carrying on with our lives. So it's something that we need to kind of work closely with others on. And Public Health England is really stressing that, you know, in terms of, you know, looking at how we utilise our local outbreak control plans, this is very much around recognising when, you know, our rates start to increase, even if that's at a very small level. So I don't know whether we would sort of apply any particular criteria around local lockdown. It would certainly depend on, you know, if we have an outbreak, where that is and what that looks like, and how well, you know, if it's in a particular setting or something like that, how well individuals are able to self-isolate and sort of limit transmission that way. So whilst I can't give a kind of hard and fast answer, you know, to that question at the moment, it is something that we are sort of learning more about, and will sort of develop over the next weeks and months. But
so it's not as clear as, you know, I think the government, I think we're probably all brainwashed into the R number and a certain, you know, if it's below 1 it's okay, and if it's above 1 it's not okay. It sounds like what you're saying is to not be as simplistic as that. It might be if it's a school and there's an outbreak, you might treat that differently to if it's, I don't know, a hospital, I guess, which is a worry.
But or if it's you know, more of a community transmission where, you know, which might affect a school and maybe workplaces and other sort of settings within a local community. So, you know, we're looking very closely at, you know, how local authorities are managing, you know, and also Public Health England are managing in other areas. And of course, in any sort of instance such as that, we'd be working very closely with Public Health England, who are the real experts in managing outbreaks, and we would be following their advice and using our local sort of outbreak control group to kind of manage any local outbreaks very closely. Okay,
I think the only thing I would say, and that's just a personal thing, just off the top of my head, but I think people need to understand, it's really important if you want the community with you, that people need to understand why, how, where. Otherwise, if there's just confusion, it's not going to help people to, I use the word comply, kind of take part and say, well, I'm going to do, I'll actually will self-isolate if they see somebody down the road who's still carrying on and maybe showing, you know. So I think, you know, I always say, I'm a stuck record, communication, clarity, making sure all the community groups understand. I think it's really important to make sure that we you know, we make that successful.
Yes, absolutely. And I think there's a lot more work that we need to do on that. And
absolutely.
Yeah.
Okay, I'm going to move us on to the next question. I think this might be you, Andrew. So actually, this is again around disability. So there's a question here around deaf and another one blind, but I'll take the deaf one first. What actions are being taken to ensure that the deaf community are getting the same messages around how to keep safe along with everyone else?
Yes, another really good question. I know that some of the departments in the council, particularly around learning disabilities department, have produced some easy to read guidance. Public Health England have also produced some really easy to read guidance, which are very, very visual. So it might help kind of explain things through kind of visual demonstration, which might be useful not only for the deaf community, but also for people with learning disabilities and things like that. So that might be something that might be useful. We do recognize that this is still an area with lots of challenges and probably a lot more work to be done. And I know certainly for me, Healthwatch has always been kind of like a great organization to help highlight challenges amongst these communities that I think, unfortunately often go forgotten. So, I know as the public health team, we'd be more than welcome to work with Healthwatch moving forward to see if there's other gaps around this areas that we can help fill and work towards, producing something or working together to kind of get those messages out in a more effective way.
Yeah, I mean, it's definitely important to work with the community. So at North Mid, for example, had the same issues, and we flagged it through our deaf community around the face mask, because as more people are wearing face masks and coverings, actually, they don't even have a chance to lip read. So I know the NHS and actually the North Mid came back to us and was asking us questions around clear face masks, and we were getting some of our people from the community to have a look and contribute. So there are ways to do that. I just think, again, it's making sure we cover all areas of the community. So the next question is moving on and is similar, but just a different perspective. And again, until people feed in, sometimes you don't think about these things. So this point is, I'm blind and I have been struggling. So for example, where someone would help me cross the road, people now don't want to come near me and take my arm and help. So what support is being considered to help people like me?
Yeah, again, I think this is a real challenge, and we do recognize that. I think for those that have kind of been receiving support locally, maybe from Enfield Stands Together around things like shopping or engaging with people on the phone, things like that. Again, as Judy mentioned, the council's currently exploring ways of kind of carrying forward an ongoing support offer around this. I know that there's the Royal National Institute of Blind People who also have developed a helpline and have been promoting that through the COVID-19 pandemic as kind of a route to help those that are partially sighted or blind to access other services that might be useful for them. They've also kind of specifically speaking to this point, I don't know how much of a helpful answer it is, but I know that the Royal National Institute of Blind People have also worked with other groups and organizations, such as the Health and Social Care Board, and they have produced some guidance that has touched on this. And they said that if you don't live with someone who's able to guide you, kind of thinking about ways of overcoming these issues around social distancing and maybe not recognizing that someone is partially sighted or blind, using your cane to alert people that of your sight loss when you go out, or kind of letting other people know verbally, that you're not aware of where you are, where they are, or kind of giving more verbal cues to ask for help. Although I understand that could be challenging, in itself. So unfortunately, I don't have a perfect answer around that. And again, kind of similarly to before, I know the public health team would welcome working with Healthwatch and other individuals and organizations around this to see if there's anything that we can do to kind of help mitigate these situations for those that might have been disproportionately affected during COVID and even moving forward.
Yeah, no, completely. I mean, us, we'll always be there to help, and we keep connected with a lot of our community groups. And I think it's just, again, incumbent for all of us listening that, you know, we're all, whether, you know, people were jumping up as volunteers, everybody came together, being really supportive throughout the pandemic. I think there's something for all of us to just think about those that, you know, we don't always think about, quite frankly, and actually think, how can we help them, and can we get, again, messages to our families, communities, friends that might be able to help us support. So I think it's really important. And your point about the cane, I think that's a useful one. People see the white cane, and maybe there's a way of maybe, you know, linking in with the cane some way to support, or again, verbal. And I know also that there are videos, verbal videos, so that wouldn't help with the deaf. And I've just noted here, again, our team have been great. They've put up some BSL videos that are helpful about the coronavirus. And I know there's some easy read versions for learning disabilities, but also some of the normal, I would call, videos where they have speak over and they have voiceover, can still help those who are blind if they can access. Okay, any final comments? We've got a few minutes to go, which I'm going to wrap up. So the timing is pretty amazing, I have to say, even if I commend myself, because we've come to the last question. Any last comments on the chat? Otherwise, I will start to close. So maybe I'll start to close this. Oh,
Fazila, I just wanted to add as well, in relation to the issues around inequality. You know, we're very aware that lockdown has resulted in, you know, nationally, an economic impact. And so the council is also working very hard to support local businesses around sort of maintaining themselves where at all possible, and providing, you know, a lot of advice, information, and various other sorts of interventions around supporting the local kind of economic climate, really.
Now, and I think information and advice is going to be paramount as we kind of try and work our way through. So again, I would just stress Healthwatch have always up-to-date information and advice signposting, but there are lots of other organisations, including the council, that can support. So, you know, I would just hate for anyone that might be sitting at home that just feels they're not getting information. You know, again, as families, friends, networks, let's really try and ensure that we're making sure, whether it's verbal, whatever, that we're getting all of that information out to everyone. So I just want to close finally to say thank you for your time. I really hope it's been helpful, and thank to all of our listeners that, you know, you've found this information useful. Oh, I've just had a comment here. So disappointed, because we have got a minute. Disappointed you didn't raise my question on how the public can access the medical health risk assessment report on the wearing of masks. I didn't see that question, so that hadn't come through on my system, but I'm asking it now. So how the public can access the medical health risk assessment report on the wearing of masks? And if we don't know the answer, we can always come back.
Yes, I will just you know, go away and check that out. However, I would also like to say that if any individual feels that they, you know, have got particular health issues that might make them more prone to complications of COVID, and you know, are anxious about how they can reduce their risk further, I would very much recommend that they either speak to their GP, or if they're under a consultant, to speak to them about that issue.
Okay, thank you. And I think we'll also ensure that we have a Q&A of this call. We record it, so we'll publish it. So hopefully in the next few weeks that should all come out to help people pass on information. And I also want to flag again, as we always do, our evaluation. So do please complete the evaluation. So we do take those notes on board and try and, where we can, improve and make a difference. And finally, I would like to just mention that we are having our next discussion and meeting around young people and their mental health. So we've got the children and adolescent mental health team, as well as the head of education from the local authority, and the senior educational psychologist for social and emotional mental health. And that is on the 17th of August around lunchtime. So do please join us for that and pass the word around. And I will say again, thank you for everyone. I think I've covered everything. And if we didn't get a chance to make note of your comments or your questions, we do record the chat, and that will go through to the public health team also. So all of your points made will still be noted. And wishing you, all the best for today and the coming weeks. All right, then, take care, everyone. Thank you.
Thank you very much, everybody. Thank you for joining.
Thank you, everyone.
Thank you.
And I'm just stopping the recording. Okay. Take care.
Bye.
Okay.